Okay, so chapter 5 of the ACE 6th edition Certified Personal Trainer textbook. And chapter 5 is on pre-participation health screening. Just a couple of things, as always, before we start. Remember to have a pad, writing paper, whatever the case is, and a writing implement, obviously. Remember, read, write, recite is the preferred method, or at least one of whatever number of methods you're going to use for studying, and just have that when you're going through the chapter. Now, one of the things that you got to keep in mind is that ACE is really trying to get you to take your time and really think before you actually start training clients. And that's one of the most important things to keep in mind, just as a sort of as an aside, is that before we train people, we have to be very, very careful that we're moving individuals from an appropriate level of whatever activity they've been doing or not doing into the proper training intensity, training duration, training frequency, all of those things that are basic variables that you're going to decide on when you start training somebody. So chapter 5 begins with sort of a preliminary to the preliminary. So a pre-participation health screening is really designed to do one thing, is to break down any barriers that there may be to somebody starting an exercise program. Remember, one of the key things that ACE wants to make you aware of and get you prepped for is the type of individuals that you're going to be seeing as a trainer when you're actually out there training people. Again, it's one of the reasons why the first couple of chapters is there's this focus on sort of clinical issues, being within the healthcare continuum. And it's probably a good idea because we're seeing more and more people with chronic diseases. So it's really a good idea to kind of step back first, get sort of a general understanding of where your client is at. Have they ever worked out before? Are they presently exercising? Are they showing any symptoms of chronic disease, or are they asymptomatic? All of those things, if we can pre-screen, right? Remember, screening is what we do before we actually start to set up a program. Well, we want to do a pre-screening. That's what this pre-participation health screening is designed to do. It's not a long chapter, but it's an important one now to sort of keep in the back of your head so that when you pass the test and you go and you start training people, it gives a much better feel to the client that you're taking time, you're developing rapport, but you're taking time to ask questions related to those issues that are related to exercise health risks and exercise problems that could occur. We want to know those things before they actually even start the exercise program, and that's what the pre-participation health screening is going to go over. So, long-winded way of saying do this before you actually do any health and medical data gathering. So remember, the goal here is to develop rapport. So as we start on page 137, there's a good amount of information just to get you prepped now for the inherent health risks associated with exercise. At the end of the day, I work out. I've been exercising for 40 years. Even for somebody like myself, there's going to be an inherent risk with exercise. There always is. It's just that when you have lots of years of experience exercising, the inherent risks are not as big of a concern. But if you have clients that come in, either they've never worked out before, or they used to work out many years ago, but they haven't trained in 5 years, 10 years, 20 years, the inherent risks to increasing heart rate to moderate to high levels of intensity, it could be a problem. That's what ACE is making you aware of now. So inherent health risks with exercise, there is a problem for individuals that have underlying cardiovascular disease. So if an individual starts to perform, like they're really excited, they want to get going, they want to train, and if they have an underlying CVD, cardiovascular disease, or an underlying issue that could lead to problems and they start to train, they get really into it and they start right off the bat, they could get hurt, they could have a heart attack. And there's, by the way, there's enough data that supports that, unfortunately. So the risk of exercise-related issues like that are highest among individuals with these underlying CVDs, and they perform at a the level of exercise intensity that they train at is much too high. They should have started lower and taken their time moving up. That's basically what the IFT model is trying to do, is to help clients to find out where they need to start. And that's what the pre-participation health screen is going to help you do. So it's really designed, and you're going to see this at the bottom of page 137, is ACE likes to use the American College of Sports Medicine, a lot of their data, which is really really good data. So they will acquiesce a lot to ACSM. So that's why when you're reading through the textbook, you'll hear them refer back to using the ACSM guidelines for this, or the American School of Cardiology says this, and they're going to use a lot of the research data that is already out there to support their recommendations for the personal trainers. So the goal here is to remove any unnecessary barriers, and that's kind of the idea. If people come in to train, want to exercise with you, and you start asking them lots of questions, and you categorize them in a certain way, it may actually demotivate them. And so what we want to do with this pre-participation screening is just pull down any of those unnecessary barriers and move people forward in their desire to start exercising. So, and that's basically what we're doing. Page 138. Now remember, anytime, I'll reiterate it over and over, anytime you turn a page and you see bullet points, that's a heads up. Okay, study techniques through textbooks. When you see bullet points, slow down for a second and go ahead and make that one of your first priorities for read and rewriting. So for instance, at the very top of 138, new health screening process, because by the way, 6th edition, ACE has made some significant changes from their past edition. Now what they're saying is there's basically 3 important risk modulators. You got to know these. It's very important, not just from a testing perspective, but it's good to know that the modulators, those things that make changes, up or down, good or bad, whatever the case is, are going to be related to these 3 things. The individual's current level of physical activity. Are they training? Do they train on a regular basis? Whatever that is, once a week, or do they not train at all? Okay, and real quick, you'll see that on these next couple of pages, because they give you this little algorithm, which is really very helpful. So current state of physical activity. What are they doing? Are you doing anything? Are you doing a little? Are you doing a lot? Because you can actually get individuals that actually train a lot. That's going to be one risk modulator. These are, by the way, risk modulators associated with cardiovascular disease. So their current level of physical activity. Do they have a diagnosed actual CVD? Have they been diagnosed with, whatever heart condition is out there? Do they have kidney issues, renal disease? Do they have any of these things that are related to the cardiovascular or cardiorespiratory system, right? Are they symptomatic or are they asymptomatic? It's a pretty straightforward flow chart or algorithm of what we do when we sit down and we talk to somebody. And that's why this is actually a really important chapter to go over. And then what is the desired exercise intensity? This is an important one, because your clients, they'll have in the back of their mind, oh man, I'd love to be able to train really hard. Well, that desire to train really hard can be a problem, right? Because some people don't know how to go from 0 to 60 in increments of 5 and 10 miles per hour. They just go from 0 to 60 and they exercise really hard. And that's a problem. So the screening protocol that ACE has put in place makes general recommendations for medical clearance. and then leaving the specifics, right? We're not the clinicians. You leave the specifics up to the medical practitioner or whatever they're going to do, and that's going to be up to the nurse practitioner or their doctor, whatever the case is. And the goal of the process, again, page 138, the goal of the process here is to identify certain things about this individual that is coming in front of you. Again, those bullet points, you should be able to rewrite those just like I would be doing right now. Goals to identify individuals who should receive medical clearance. And that's, by the way, that's what these flowchart algorithms are going to do for you. Again, and it says figure 5.1, and that's one of the things that you're going to look at in this chapter. Figure 5.1 and figure 5.1 continued. Those you should be able to, again, I would literally right from here, I would slow it down, start this process of, we're going to identify issues related to individuals that do not participate in regular exercise. And of course, they're going to give you the explanation of what all these mean. Do not let clinical terminology, get you frustrated or confused. Your goal is to memorize each of these paths that they flow down. If a person who does not participate in, you got two types of people, figure 5.1, two types of people. There's individuals that come to you and like, I haven't trained, I don't exercise on a regular basis. That's why I'm coming to you, right? My doctor said it's a good idea if I start exercising, so I'm going to start exercising. There's that type of person. Then there are other individuals that are coming to you for training that at differing levels actually already exercise. Maybe inconsistently, but I've been training for the past 2 years. I started out I'm not making the progress I want. I'm inconsistent. I really need a trainer. Okay, those are those two types of individuals. Well, now when we look at those two types of individuals, we have these paths, these algorithmic flowcharts that basically tell us, and that's what the pre-participation screening does. Okay, are you asymptomatic or symptomatic? Do you have a history of heart disease? Do you have a history of these issues, or don't you? And then that tells you how you proceed. And that's all that's saying. Individuals that do not participate in regular exercise, well, they don't have any cardiovascular, metabolic, or renal disease, and no signs or symptoms suggestive. You're not a doctor. How would you know that you have an individual sitting in front of you that is showing symptoms that are suggestive of heart issues? Well, obviously, if an individual is sitting down there and they're breathing heavy when they walked into the gym or the club, and they're breathing really heavy and their face is, red or whatever the case is, or even they look pale, anything like that seems out of the normal, that would be a heads up that, there may be some underlying issue. You can see there's an art to this, and, the specifics you get good at. When you look at somebody and you just kind of get a feeling or a sense by looking at any symptoms that they're showing, is your heart rate high? How do you feel? Well, my heart's really palpitating. That's an indicator. That is one of those indicators. And that's going to be one of your three flow paths here. So they don't show any symptoms, nothing suggestive of metabolic or renal disease, right? Medical clearance not necessary. So that's kind of the idea. You should know and memorize this flow chart. It's really not that. By the way, a lot of this is just intuitive. Now, on the other hand, if an individual is not participating in regular exercise and they come in and they want to start training and they tell you, yeah, I've got, I had a heart attack, I had this, whatever the case is, a known cardiovascular, metabolic, or renal disease. And they don't have any symptoms. Look, if you tell me you've got diabetes, that's a metabolic disease, right? If you tell me you have type 2 diabetes, it's not insulin dependent. My doctor told me he wants me to start an exercise regimen, and okay, great. I mean, I just found out I have stage 1 hypertension or whatever the case is. That's what this flow chart is helping you to understand. Well, I look at that individual and they told me they have it. That's all I need to know. whether they display symptoms of the disease or not. Okay, whether they display um, fast, heavy breathing or wheezing, asthma, for instance. They don't have to show any of those. That's what asymptomatic means. The fact that they have it right off the bat, the first thing I'm going to do is I need to get medical clearance, and that's recommended. I hope that makes sense. I don't have any of these issues. I don't show any issues or signs. This average person comes in apparently healthy, no issues. Come on, let's go. I don't need medical clearance. Client walks in. By the way, yeah, I do. I was prescribed prior to the new changes. I have, pre-hypertension right now. That would be stage 1 or elevated. But I feel great. See the difference? If they tell me they have it, medical clearance, you gotta go to your doctor, get a medical clearance. We have, I give you a form, and that's it. And then there are those individuals that have any signs or symptoms suggestive of these issues, or renal disease, right? Regardless of whether you got it or not. So it's really like, if you tell me you got it, medical clearance. If you don't have it, but you're showing that you have some issues related to it, medical clearance. And then, of course, you could go back now to the very bottom part of that flow chart, that algorithm: light to moderate intensity exercise recommended, very conservative, just so you know. Moving initially into exercise programs, depending on the person's age, physical status, whatever the case is. It's because they have not participated in regular exercise that those individuals that are asymptomatic, no known issues, we still start them light. You get a 40-year-old or 45-year-old guy comes in, he looks in good shape, but he's never worked out before. He's never done cardio exercise, or he did some cardio when he was an athlete in high school. It's been 20 years or 25 years since he's exercised. Look, just the fact that looks to be, quote, in good shape, no, he falls into this algorithm right here through that path. Okay, he's got no issues. He was at the doctor, whatever the case is, and yeah, you don't have diabetes, you don't have hypertension, and he doesn't need medical clearance. However, I'm going to start you off light to moderate intensity. And so that's what that individual that doesn't participate, it's like one of the first questions you ask. Well, do you exercise or don't you exercise? Man, I haven't exercised in 10 years. Boom, right into this flow chart. Yeah, I mean, I train on a regular basis. It's been a couple of months. I was on vacation. I haven't, but on the regular, do you normally train? I've been training on the regular. Sometimes I'm inconsistent for the last, for my entire life, or the last 10, 15 years. Okay, well, now you fit into a participant that participates in regular exercise. That's a different flow chart. And so this individual now, and you can read through it, of course, memorize this flow chart. An individual, same thing. They don't exercise or they do exercise. If they don't show if they're asymptomatic, there's nothing that would be of concern to me. No medical clearance is necessary. However, the difference is that if you have been exercising, instead of starting you off light, like I would with a non-exercising new client, I'm going to continue with moderate or vigorous intensity exercise. I'm actually going to keep you exercising now pretty much the way you're doing it, versus a non-exercising where I'm going to start a little bit less intense. So that's the difference that you're looking at. If this individual who participates in regular exercise comes in and says, I train on the regular, once my doctor told me 5 years ago that I needed to start cardiovascular training, that's what I've been doing, taking medication, whatever the case is, that individual participates in regular exercise, but has a known cardiovascular metabolic issue. Now you're going to need a medical clearance as well. And so that's what this middle part of the flow chart is going to tell you: medical clearance in the past 12 months, if no change in signs and symptoms. Again, don't get so so thrown by the amount of written material in here. No, it's intuitive. It makes sense. Okay. No issues, no medical clearance, moderate intensity. Never worked out before, no issues. That's what I would write. No issues, no medical clearance, low intensity. I would hope that makes sense intuitively. A lot of this stuff is intuitive. It's just in a formalized fashion. On page 141, ACE has given you basically a sample questionnaire that you can use. And this is the pre-participation health screening for exercise. This is what you would use as a fitness professional. And again, this is ACSM's, American College of Sports Medicine. This was created only a couple of years ago. But this is what ACE, again, acquiesces to ACSM and says they got a great questionnaire. Let's just use this. And that would be my recommendation as well. You simply have them fill these out. And then there's the evaluation steps 2 and 3. If you did or you didn't mark it, and you would look this over. If they did, you would want them to do this. If they didn't mark any of the statements, then you would do this. And that's basically all that's telling you. Now, again, a couple of bullet points. Intermittent claudication, known heart murmur, unusual fatigue or shortness of breath. Those are going to be some of the things that you're looking for when we talk about showing some signs or symptoms of cardiovascular disease, metabolic disease, or renal issues. Of course, page 142, 143, and 144, read through this. Just keep in mind the mover method approach, or the ABC approach, is just giving you a sample. I would say for the most part, read through what ACE is suggesting as a normal conversation that you'd have. Obviously, ACE is not telling you this is exactly what you say. The goal of the mover method box and the ABC approach is just to give you sort of a guideline, a hint on how you would talk to or speak to a client. So for sure, read through that, unless you don't, you're on a time crunch, but really good sort of back and forth communication here between a client and the trainer. Resistance training, and then of course the self-guided. And by the way, the resistance training component here, very interesting that they put this in. We've known this actually for a while, that the current evidence is insufficient regarding cardiovascular complications during low to moderate resistance training. In other words, quite honestly, get on a treadmill and start putting stress on your CV system. We have really lots of good data that basically says, here's what's going to happen based on your starting fitness level, et cetera, et cetera. What we don't have really good data on is when you start to do bench presses or when you're doing squats or something. How does that affect cardiovascular disease risk issues? Well, there's really not a whole lot of data on what the complications are. So it's one of the reasons why we see clients they will jump right into a strength training, resistance training program and not show any issues or problems, but you get them on the treadmill and they fall out. Well, again, let's just keep in mind all the parameters, all the variables, all of the things that we throw into training programs for clients. Cardiovascular training is the one that's going to help your overall health and wellness the most. It's primary because it's the heart and the cardiovascular system. It doesn't mean that resistance training is not important, obviously, but just keep that in mind as you read through that very, very short paragraph of 2 sentences. So now we move into the self-guided screening. This is the PAR-Q+, so the physical activity readiness questionnaire for everyone. And basically the idea, what ACE is saying, is that once you do the pre-participation health screening and they want to initiate their exercise program, you can then conduct the PAR-Q. It's evidence-based. And the goal was, again, reducing, as they say, unnecessary barriers to exercise. Believe it or not, you can actually have your clients or an individual can fill this out themselves. Now, look, 1, 2, 3, 4-page PAR-Q plus. Okay, this is very, very in-depth. Just keep that in mind. This is, again, you read through this, utilize this. This puts you utilizing an extensive PAR-Q like this, puts you at a totally different level of what you could call professionalism and interest in preliminary information about your client. So people can actually fill these out themselves, but when you have them fill it out, of course, you're going to have them fill all the way down, participation declaration, things like that. This is a very inclusive document to use. And then there are the additional forms on page 149. And, the idea is that you use these additional forms to fill in any of the information gaps that you may have with your client. Now, look, page 149, what do we see? Yeah, bullet points. Write down those bullet points. Lifestyle, health history questionnaire collects more detailed medical and health information beyond the little pre-participation health screening. So past exercise, medications, and supplements. These are things that you got to know what meds they're on, if they're on any meds. That's what this is doing for you. The funny thing, of course, is that when I first started training people, I seldom did any of these. I would talk, I'd ask, and I'd write it down. Okay, I would just write down they're on meds, and I would be able to, only because I was at that level of training and education where I could actually look up a medication. Doctors, I could always call a doctor. I can always talk to somebody and say, what does this med do? Well, oh yeah, that's a beta blocker, or oh yeah, that's an ACE inhibitor. Okay, well that's a bronchial dilator. So that, and then I would get to know a little bit more. So if I trained them, what are the problems? And I'd have clinicians basically say, well, just don't train them too hard, or just don't do this. Now we're talking the 1980s. Okay, 1980s. It's not like everybody was into exercise. We didn't have a ton of data like we do today. So one of the reasons why we have additional forms and we now are able to ask these questions and get them formalized is because we have a lot of data that basically says, here's the recommendation, best practice, client, patient or client-centered engagement. That's what this is about. So surgery, injury, medical, all you're doing is getting it on paper now, versus what I used to do many years ago, which is just ask them, oh, you had your shoulder operated on. Oh man, I better write that down. And I'll just put that in your shoulder. What happened? Got it. Was there anything else that I need to know about it? No, it's fine. It only hurts when I laugh or whatever. But the point is that I could always did contact a doctor. If it's not theirs, I would contact a physician that I knew. Okay. You're actually finding out that information and putting it on these specific forms. The medical release, of course, is just a way of ensuring. And by the way, page 150, 151, these are health history questionnaires. Once again, pretty extensive amount of paperwork if you want to do it, to the T. 1, 2, 3, 4, 5. Well, the fifth one is the sample medical release form, but 4 pages of health and medical history. However you do it, this is just very extensive forms. Highly recommend that you use something like that for sure. You got to use something. That's a standard in the fitness industry today from a personal trainer. You've got people filling out forms, a bunch of forms. And this just contains pretty much everything that you would need. And then if you do need a medical release form based on the criteria you already looked at the beginning of this chapter, get the medical release, have them sign it, have the physician. One of the things I always used to do is I would ask them, do me a favor, just make sure your doctor or whoever your clinician is that's doing this, have them write down anything for me, because I want to make sure that I'm doing everything in line with what a clinical professional is saying. Yes, you have high blood hypertension, high blood pressure, but Just let your trainer know, recommend dot, 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 recommend dot, dot, dot. If I get that from my client and I look at it, I go, fantastic. I'm going to circle that and make sure that when we do our cardio, we're doing it like this. The other reason is because if I'm wearing a heart rate monitor, if I'm wearing a heart rate monitor, or got my client wearing a heart rate monitor, I can be very, very specific and use the credibility of their doctor. Okay. I just want to train harder. How many clients have I trained that are like, I'm not training hard enough? No, actually, you're at 65% max heart rate, 60. That's where we want you. I know it doesn't feel like you're doing much, but give it a little bit of time. After a couple more workouts, I'm going to let you jump up to 70 or 75 or whatever the case is. And by the way, when I pull out their medical release form, that's what your doctor said. No more than 65% for the first 2 weeks, whatever the case is. I'm not saying that doctors are always going to give you that information, but if you can get it, it's highly recommended. Here we go on to medications. What we have found over the last, I don't know, 30 years now is just this incremental increase in the total number of meds and doses of meds that are being given to the average apparently healthy individual. I don't think after, I don't know, after 2000, 2005 upwards, I started getting more and more and more and more clients all on antihypertensives. That's probably one of the biggest ones that are given out. And of course, cholesterol meds. But back in the 1980s, for instance, late 1980s, not so many people. Didn't find a whole lot. If they were on anything, it would be some basic, very very low dose antihypertensives, normally first generation hypertensive meds that were normally ACE inhibitors, some beta blockers, but folks would be on these meds. They were using them. Sometimes they'd stay on, sometimes they wouldn't. Nowadays, wow, we see people on any number or groupings of drugs, and of course the newer generations, for instance, of antihypertensives. Don't get me wrong, very beneficial, but you as a trainer, you got to be educated on this, and that's kind of the point. Know the medications and know their responses. One of the things, probably one of the most important grouping of medications are the antihypertensives. Go to page 156 and spend time. This is going to be my recommendation with table 5.1 is to look at, it can be a little confusing. You've seen all these arrows. Normally, the way I have done it for myself from a study standpoint and then learning and memorizing this was to group the meds. See, in the medication column, it's you got beta blockers, and then you've got the ACE inhibitors, the angiotensin 2 receptor blockers. Those are called ARBs, calcium channel blockers, and other antihypertensives. And so what I would do is I would take each one of those and I would group them. For instance, beta blockers lower resting heart rate. So I would group all of the meds that lower resting heart rate, and I would put them and I would study them from that perspective, right? So I know beta blockers reduce resting heart rate. They also reduce or buffer or moderate exercise heart rate. So both the ACE, the ARBs, and the calcium channel blockers, beta blockers, basically do the same thing. So you could group those two together. There are other hypertensives, and they actually give you a little bit more information down below. Others actually raise resting heart rate or raise exercise heart rate. And then exercise capacity, and then the comments. The way I would handle this table is to group them together. For sure, there are medications that elevate not only resting heart rate, but for the vast majority of these meds, they elevate exercise heart rate. And that's what you got to keep in mind. And those are the things you have to know. So that's why table 5.1 is really important. Look, it's not a bad idea to read. on page 157 exactly what these classes of drugs actually do. What do beta blockers do? They are a class of antihypertensives. They work in any number of ways and through different modes of effects on the cardiovascular system. Beta blockers work differently than calcium channel blockers. Okay, that tells you pretty much what their mode of operation is. The angiotensin converting enzyme inhibitors, those are your ACE inhibitors, right? They block certain enzymes that are secreted by the kidney, for instance. The ARBs, or the angiotensin 2 receptor antagonists. And like I said, you have all of these listed in table 5.1. Diuretics. Most people know what diuretics are. A body to excrete or eliminate water or fluids. Often they are combined into single meds, where diuretic is combined with a ACE inhibitor. Just as an example, bronchodilators. Asthma is a huge problem when it comes to the average person thinking they have their asthma under control, and they normally use rescue inhalers, or they're using some other med on a regular basis. One thing I always used to do was make sure that my clients always had their rescue inhaler, and I would ask them to bring me an additional one that I could keep in the training center with their name on it, because more than likely at some point they would forget theirs. And the last thing you want is to have a client who has controlled asthma, meaning they've been to a physician and they've got them on medication. Remember, there's controlled asthma, there's uncontrolled asthma. Big problem if it's uncontrolled, because you can have an exercise-induced asthmatic issue, right? During your training, if it's hot outside, they haven't drank, and you get all these complications, and then they have an asthmatic attack, and boom, they should pull out their rescue inhaler. That's what an albuterol inhaler is for. Take their puff, and they're good to go. Well, what if they forget it? I got the other one, and I let them use that, but I take it back for them, and I put it back. And I've always got a backup. Critical, really important, because it's happened to me any number of times. And so thank goodness I had the backup. Cold medications, of course, these will contain certain compounds that could have an effect on in this case, what they say, vasoconstriction, and issues with the lungs and breathing. So cold meds contain, antihistamines, things like that could have a problem. So chapter 5, really, really important. Remember, go through, really get those tables down pat. Very helpful information. Read through the ABC approach box that was in there. Read your summary, and then I will see you next at the end of chapter 5. I'll see you next on chapter 6.